Hypertension is a common condition we see in the office, and that can be a condition that can be tricky. Sometimes it's not just one particular solution that takes care of the problem. Sometimes it's a culmination of multiple approaches to get someone under control. I'll give patients recommendations to pick up a blood pressure cuff. Have your own blood pressure cuff at home and check it. And once you find levels under control, I don't think you necessarily need to check blood pressure every day, but while we're trying to get patients' blood pressure under control, we'll generally have them check their blood pressure once or twice a day, or if they're having symptoms. The general goal for blood pressure is about 120 systolic, which is that top number, and 70 diastolic, which is the bottom number. If we can get to those numbers, I feel pretty comfortable that the patient's going to be at less risk for heart cardiovascular disease. What we don't want is blood pressures over 140 systolic or over 90 diastolic. Then what I see happens is that patients end up having extra pressure in this sort of pump system and ultimately leading to heart disease or vascular disease and irregular heart rhythms. To control blood pressure, generally we'll try lifestyle changes first. Try switching to, less salty foods. Try getting some exercise on board, and sometimes just weight loss alone can take care of the problem. I'll tell my patients, we've all watched a show, The Biggest Loser, where someone's made significant changes in their lifestyle, and now some of these people are off all their medications. So I think when lifestyle changes are first an option, if you can get those under control, then I think you've definitely got your start towards wellness at that point. Certainly, plenty of patients we have are on medication for blood pressure, and that's definitely an option for cases that are resistant or not improving with lifestyle changes. And those are cases where I'd follow closely with the patients in the office to get things under control. So in a nutshell, I would tell people, make sure you're watching your blood pressure. Understand that if it stays too high for too long, that you're at risk for damage to the system that is going to either be irreversible or take time to correct. And then also get ready to make some lifestyle changes, and if needed, consider medication.